I'm Dr. Cielo Gnecco, and I've been an OB-GYN for Orlando Health Winnie Palmer Hospital for women and babies since August of 2020. Today's taboo topic is weird, controversial, or taboo questions to ask your OB-GYN. Can it be normal that as we age, we have decreased sexual desire? Yes. But does that mean that you shouldn't do anything about it? Absolutely not. So in the United States, approximately 40% of women do have sexual concerns. And though many women think this might be normal with age, low sexual desire can be caused by a combination of factors, such as women's lifestyles, issues with their partner, and associated medical conditions such as use of certain medications like antidepressants. Now, female sexual dysfunction takes different forms, including lack of sexual desire, impaired arousal, inability to achieve an orgasm, pain with sexual activity, or a combination of these issues. So if this is something that you're experiencing, please talk to your gynecologist because there are a variety of treatment options depending on what type of dysfunction you have. Some patients believe that they should not be screened for STDs because they're in a same-sex relationship, but this is wrong. STDs are spread through sexual contact with someone who has an STD. Sexual contact includes oral, anal, and vaginal sex, sharing of sexual toys, as well as genital skin-to-skin contact. Infections such as HSV and HPV can be spread by contact with the area around the genitals. So make sure you see your gynecologist regularly for screening of STDs, and you should feel comfortable talking about your sexuality and tests that are appropriate for you. If your pregnancy is low risk, you can definitely have sexual intercourse through your pregnancy. There are conditions such as having a short cervix or an abnormal location of the placenta, which can be contraindications to having intercourse. You can always talk to your provider if you're unsure. A woman's long-term capacity to achieve an orgasm is usually unaffected by routine pelvic surgeries, including a hysterectomy. Oftentimes, women will have issues with intercourse right after having surgery, but these resolve short after. A hysterectomy does not affect a woman's ability to achieve an orgasm, and depending on the reason for the surgery, it can actually make sexual intercourse more enjoyable. So make sure you talk to your gynecologist if you are having issues after surgery. The IUD is one of the most effective long-acting contraceptives, and they are commonly used on patients younger than 18 years of age. It not only can be used as a method of contraception, but it can also be used to treat heavy menses after an appropriate workup. There are very, very few contraindications to the IUD. Some of these include certain anatomic abnormalities of the uterus, acute pelvic infections, suspected pregnancy, amongst others. Leaking of urine when coughing or sneezing is known as stress incontinence. Though a thorough evaluation is needed for this diagnosis, there are many treatment options available. These can be as simple as pelvic floor therapy, time voiding, certain injections to the bladder, pessaries, or more treatments such as slings or other different surgical interventions. Thank you for watching. Join us next time for another edition of Taboo Topics.